We're live. Hello, welcome everybody to the Yak Show. My name is Tiade, and I'm excited to introduce our guest who has been patiently waiting this afternoon. Is the Health Critic. Is David Shepherd, the MLA for Edmonton South Center. He needs no introduction. So thanks again, sir, for coming onto the show.
My pleasure, T. Thanks for having me. It's always good to join you.
Awesome. Okay, so I noticed there's a lot of contention between I don't want to say you because you're the health critic and that's your job, that's what you do. What is wrong with the health minister and doctors?
So, yeah, we have, unfortunately, a very acrimonious relationship right now between Health Minister Tyler Shandro and doctors in the province of Alberta. So, a Minister of Health, their job is a challenging one. It's one of the most incredibly important positions in the provincial cabinet. They are responsible for the largest share of the provincial budget. They have an incredibly complex ministry. They are responsible for protecting and supporting our public healthcare system. And that's a system that involves a lot of different stakeholders and a lot of different people that make that system work. And amongst those, of course, are physicians. And that includes everybody from your family doctor that you see every day, all the way up to, the folks that work in emergency care at the hospital emergency room, the folks that are in the ICU, the folks that are surgeries. Those are all part of the spectrum of doctors and physicians in the province of Alberta. So physicians, as part of that system, take up a very large part of the healthcare budget. That's understandable. They provide the majority of services. So, of course, governments have been working for years to try to find ways, how do we save money in healthcare? As things get more expensive every year, our population grows, our population gets older, we develop new treatments. All these things cost more money. So there's always been work to try to find ways that we can bring down the costs of that are represented by doctors in the healthcare system. So when we were in government, we worked really closely with physicians over 2 years. I think, Minister Sarah Hoffman, she worked with the physicians and got a historic agreement with doctors in the province of Alberta that realized about $500 million in savings from what would have been spent over the next 4 years compared to what actually ended up being spent. So that was a $500 million reduction in costs. And then another agreement negotiated where doctors took absolute zeros. So to be clear, under previous conservative governments, we'd seen doctors' fees go up every year. Sometimes that's appropriate for inflation, but they were getting higher. So that's where we they came in with the UCP. So Tyler Shandro came in as part of a government that committed that they were going to reduce healthcare costs, and they had to negotiate with Alberta doctors again. So the footing that they went in on is they started by passing a legislation that basically said, oh, by the way, that contract you have there between the province and you, we can tear that up anytime we like for no reason, just because we decide to. Now let's sit down and negotiate in good faith. So that's not exactly the most trusting position to come in on. And then following that, they introduced a sweeping number of changes that they wanted to impose on some of the ways that doctors bill and some of the things they're able to bill for. Doctors were very concerned, began reaching out to me and sort of saying, hey, if they make these changes, family doctors in particular are really going to be hit hard. This is going to affect their ability to see their patients, to be able to spend time with their patients. This is going to drastically hurt our ability to provide proper health care for Albertans. Those negotiations were pretty tense. They had to get an outside arbitrator, and a mediator, that went till the end of February. And while the Alberta Medical Association, which is the body that represents doctors, was away preparing a new offer, the government decided to tear up their contract with no notice. So all of a sudden, doctors are without any agreement, without any contract. The government said, we are going to impose a new structural framework on you as of April 1st. Now, of course, at the end of February, we were just coming into the COVID-19 pandemic. So doctors were deeply concerned. They were trying to figure out how they were going to change their practice, how they're going to be able to help people. And then they found themselves, unfortunately, having to fight with the government at every turn. We had a health minister that was on social media attacking doctors, calling them greedy and entitled, saying that they were abusing the billing code system. He was fighting with them right up until the middle of March, when we actually had a global pandemic, looking at a total shutdown. He's still on Twitter fighting with doctors. It got to the point where he actually showed up on a doctor's driveway in Calgary, and one of his somebody in his neighborhood, to yell at him because he didn't like something that doctor posted on Facebook. So that's the tension that we saw building. The government, unfortunately, forced through their changes on April 1st. So doctors had to learn a whole new system of billing codes, go to hours of seminars and try to figure all this stuff out, again, in the middle of a global pandemic. So we had total chaos. The doctors, all this uncertainty on top of doctors in the middle of what's probably one of the toughest parts of their career. At the same time, we still had the minister and his staff putting out all kinds of misinformation about doctors, continuing to attack them through government accounts. And so we had a toxic atmosphere that's just continued to get worse and worse and worse. So that's really the heart of the issue, is that we have doctors who have offered a 5% pay cut across the board. They've put all sorts of things on the table that the government continually rejects and has been negotiating in just incredibly bad faith. So we saw in July that the Alberta Medical Association indeed did a poll of their membership. And of the doctors that responded, 98% responded to say they have no confidence in Tyler Shandro as the Minister of Health. So that's the sort of the quick summary of the situation and the challenge that we face between the Minister of Health and doctors in the province of Alberta.
That's awesome. So when you look at Bill 30, which you start to go into there, what are the key elements that we all should be wary about? Why is it a danger to public health care in Alberta?
So the challenge with Bill 30 is really what it is it is the blueprint for how Jason Kenney and the UCP intend to force more American-style private profit in our public healthcare system. Now, let me explain a little bit about that. So just today at 1 o'clock, we had a historic decision that was made by the Supreme Court in BC. So what happened is there was a doctor in BC who was running a private clinic providing back surgeries, and he wanted the ability to charge patients directly privately instead of it being billed through the public healthcare system, and essentially to create a two-tiered healthcare system. They went to court, and it's been in the courts for a number of years, and today the BC Supreme Court ruled that that is not allowed. They ruled in favor of the province of British Columbia and said it is the responsibility and it is allowed for provincial governments to keep rules in place to prevent the installation of a private healthcare system that would undermine the public healthcare system. Now, what we have in Alberta and in Bill 30, the first step of, is Jason Kenney and the UCP are doing everything they can to skate right up to that line without quite crossing over. So what we see in Bill 30 is sort of them taking further steps compared to what they had done before. They've been working to undermine by attacking doctors and trying to knock them out as gatekeepers in the healthcare system, as people who are in it for their patients, who are the front line of understanding what patient care is and what needs to be done, and instead replacing them, moving them aside. So Bill 30, one of the things it does is allows a corporation to bill like they are a doctor. So up until now, the only people that could bill the government for a medical service is a doctor, or in some case, dentist that would provide a dental surgery. Now, instead, a corporation, so like say, TELUS, they bought a series of clinics, so they could run that clinic now. They could bill the doctor for the patient services, the services that are provided, and put the doctor on a salary. So all of a sudden we have doctors being taken out of the driver's seat in terms of running a business and trying to prioritize patient care, and we have corporate shareholders being put in instead. So that provides all kinds of incentives now for a corporation to tell doctors, hey, you need to spend less time with those patients so we can get more people through. Hey, you should turn away patients that are too complicated because we don't make enough money. We only want to have the cheap, easy patients. Hey, we want to make sure that you push more tests, push more services, because then we get to bill more money. So it takes the priority of patient care out of the forefront and puts profit in instead. And one of the other aspects of Bill 30 that does that as well is now opening up way more opportunity to operate private surgical facilities in the province of Alberta. Now, there's been a certain number of those that were operating. They were there when we came into government, and we continue to use the capacity that was there for a limited number of fairly basic surgeries. Bill 30 is giving Tyler Shandro now the ability to drastically increase not only the number of surgeries, the complexity of those surgeries, but the number of surgical facilities, and it removes a lot of the checks and balances that were there to protect the public system. So it used to be that the minister, before he could approve a surgical facility, had to prove that that facility would not undermine or hurt the public system or public access. You would have to demonstrate that that was a service that was in fact needed, and it had to be done through an ordering council, which provided transparency. That had to be publicly published. The Bill 30 changed all of that. It removed all those checks and balances, and now the minister just simply has to sign off on it in a way that now does not have to be published. So the public does not have a right to transparency to know what is in the contract that the minister is signing. So indeed, now we have way more opportunity again for them to put private profit first. And indeed, that's what we saw now as the minister has been meeting behind closed doors with a group here in Edmonton about the UCP donors, insiders, lobbyists who want to build a major private hospital here in the city of Edmonton to take over the majority of joint surgeries. And we saw the minister meeting with them in a back room, talking to them when they're trying to get a contract where they can guarantee that they will make a profit. And any risk will fall on taxpayers, and that it will be so expensive for the government to get out of that no future government would be able to, even if it was not provided public benefit. That's what Bill 30 is opening the door to. The other concern is they're making these massive changes to the system, and they're also undermining all of the groups that we have in place to act as our watchdogs. So we have the Health Quality Council of Alberta. They're an organization which exists independent of government, and they used to report to all 87 members of the legislature. They track and monitor the quality of the healthcare system in Alberta. They would issue public reports. They would provide information letting us know about what was happening in the system, what changes might need to be made, what problems might exist. Bill 30 took away their independence. They no longer report to all 87 members of the legislature. They report instead directly to the Minister of Health, and he has new power now to direct their work. So not only is this government making massive changes, making more room for private profit, they're taking away the checks and balances that are there to provide transparency and make sure that system is properly serving Albertans. So those are some of the major concerns in Bill 30.
All right, thank you. I've got a follow-up question there. So is this what you're seeing more and more from this government, putting private profits first, backroom meetings? These are instances of cronyism, is it not? Is this what you see typically of this government?
Well, to be clear, that is the record of conservative governments in the province of Alberta when it comes to attempts to push more privatization into our healthcare system. Because let's be clear, we have been here before. We saw this back in the 2000s. We saw something called the Health Resources Center in Calgary, which was sort of given a lovely government contract to do basic surgeries. And what we saw was that clinic indeed was cherry picking the easiest and the simplest surgeries to do, leaving the more complicated ones to the public healthcare system. They do that, but then they were being paid on the average cost, so they were making a nice profit on that. Even then, they ended up not being able to make a go of it. That clinic ended up going bankrupt, and the Alberta taxpayer had to bail that clinic out. We had to take on their debt. We had to pay for it, and we had to continue to operate that clinic until it finally shut down a few years later. And when they reviewed their work afterwards, they discovered that the cost for surgeries were anywhere from $500 to $1,800 higher than what it was costing us in our public healthcare facilities. So every single time we've had conservative governments move to create more American-style private profit in our public healthcare system, they always have had their friends, their donors, their party members waiting in the wings for the opportunity to make a profit. And indeed, that's exactly what we're seeing here again. So cronyism is absolutely the word for it.
Right. So I'm just wondering, what is your timeline for when ordinary folks like us will begin to experience this shift to American-style healthcare in Alberta? Do you have a timeline? Do you know what they're working towards, maybe?
So in terms of the private surgeries, they put out a request for expressions of interest earlier this year. And so they're currently working through those contracts. They'll be continuing to do that through the end of this year. And then we'll be able to see those contracts for those private surgeries, surgical facilities, and some of that work coming up. They've recently also opened up request for proposals, expressions of interest proposals on privatizing the lion's share of lab services in the province of Alberta. So taking quite a bit of stuff out of the public system and again, putting putting it out to private tender. They're looking at doing the same. They're exploring doing that for ambulance systems and EMS as well. So this is over the next year is where we're going to really see a lot of that work happening. But in terms of some of the other effects, like I've been talking about their war on doctors and their work to undermine doctors to create that space for more corporations and folks to move in, that damage is already being done and it's already being felt. So what we saw starting in April is more and more doctors sort of saying, I'm sorry, I can't run a clinic and work in the hospital, which is what most rural doctors had been doing. So rural doctors withdrawing their healthcare services. We saw that happen in communities like Sundre, in Stettler, in other areas. And indeed in Sundre now, there are no obstetrical services available at that hospital. Any woman that is going to give birth in the Sundre area has to travel further. That's directly as a result of this government's actions. And we're seeing the same thing with family doctors. So we just found out the other day, 5 of the 8 family doctors in one of our most celebrated rural healthcare clinics in Sundre, the Moose and Squirrel Clinic, are going to be leaving Alberta as of April 2021. Because again, of the changes that are forced through by this government, the incredible uncertainty, the toxic environment they've created, that's happening in rural communities and indeed in cities across the province. So those effects are already going to be felt. But I think really, especially over the next year, is we're going to see even more of the effects and the damage being done.
I'm not a spokesperson for the UCP, but when I read what they put out, one thing they say is doctors in Alberta are overpaid. So what do you say to that? And Bill 30 is to streamline doctors. Is there any truth to that?
So doctors, like every other profession in the province of Alberta, make more in this province than their counterparts in other jurisdictions. That's the reality. Alberta is a high wage earning province. So that's been as a result of the boom in the oil sector and that sort of thing. That drove wages up. So certainly doctors in Alberta, like any other profession, they do earn a higher salary. Now, the thing is, when the UCP throws around these big numbers, they talk, $300,000, $350,000, $400,000 worth of billings for a single doctor. Let's be clear, that is not the doctor's take-home pay. That is their gross billings. Doctors are small businesses. They are sole proprietors. So when they bill, say, family doctors say they bill $300,000 in a year. Out of that, they are paying for their clinic space. They're paying their monthly rent. They're paying for their equipment, their software, their IT infrastructure. They're paying all of their staff's salaries. And in rural Alberta, those are local people in those communities who are earning those salaries and putting that money back in their local economy. Then doctors are paying they pay their licensing fees. They pay for their medical insurance. And they pay for their ongoing training. And as sole proprietors, they do not have pensions, they do not have sick leave, and they do not have maternity leave. So these are all things doctors are paying out of pocket. So when you see the gross billings of $350,000, in some cases, that family doctor is maybe taking home $150,000. Sometimes less, depending on what their clinics are. So certainly there are some doctors who are higher earning. It all depends. Because again, when we're talking about doctors' pay, we're talking about everything, again, from your local family doctor all the way up to somebody who's a radiologist or a neurologist or all the way to the top of that spectrum. So it's a very wide range. So certainly, again, we got to recognize doctors have offered to take a pay cut. They offered this government a 5% across the board cut to all fees. That was an offer the government rejected. They said that wasn't good enough. So it isn't about money for physicians in Alberta. And certainly we need to find ways to contain costs, especially doctors recognize we're in a difficult time. They provide mental health support to their patients too. They talk to people every day and see how the average Albertan is struggling right now. Doctors are willing to make a sacrifice too, but it has to be a collaborative work between government and doctors. And so far, we've seen from what we've seen from Tyler Shandro and his government, they aren't willing to have that collaborative work.
Okay, so they also say it's a question of accountability that doctors in Alberta are not particularly transparent or accountable. What are your thoughts on this? Do you agree with that assessment from the other side?
So today we saw an announcement from Minister Shandro that he's going to follow through on the promise that he made earlier this year that he is going to publish a sunshine list of doctor compensation. So I don't think that's unreasonable. Certainly, yes, we are spending public money. We should have public transparency. Now, of course, the UCP themselves are pretty hypocritical on this file. They founded their $30 million war room and did it they used all kinds of legal maneuvering to do it in a way where they have no transparency to the Alberta public. We're dumping $30 million a year year into a institution headed by one of their former candidates, and we get no reporting, no transparency on a single dollar that's spent. We don't know where any of it goes. At the same time this year, they were required to provide a fiscal update by the end of June to the Alberta public on their first quarter in office. They passed legislation to delay that by 2 months and tried to blame it on the Auditor General until the Auditor General's office spoke up and said, actually, no, we're good. We can deliver on time. It's the government themselves did not want to provide that transparency to Alberta while we were sitting in the legislature. So for this government to claim that they're all about transparency, a bit hypocritical. But when I talk to doctors across the province, they're not generally not concerned. They're happy to provide transparency, provided that this government also provides people with the context and is open and clear about the fact that these are gross billings, that they don't take into account doctors' expenses and all the other things that are involved. Unfortunately, what we've seen with this government is all the information they use, whether that's in their McKinnon report, their Ernst & Young review of Alberta Health Services, and even just their use of general public data, they're utterly disingenuous. They twist it, they misrepresent it, they try to use it to paint as bad a picture as possible in their war on doctors. And that's only going to create an even more toxic relationship and an even more difficult circumstance. It's going to just create more chaos and drive more doctors out of the province. So in general, it's not a bad policy, but I'm deeply concerned for how this government is going to implement it and that the further damage they could do.
I mean, I hear a word like toxic relationship, and I know that the NDP has mounted quite a fierce opposition across board against this government, and you guys are very, very busy. And I just wonder, do you collaborate at all with Health Minister Tyler Shandro on anything? Do you like have coffee together or smoke together? I don't know. Does that kind of collaboration occur at all between the Health Critic and the Health Minister?
I can say that throughout the COVID-19 pandemic, as some issues were brought to my attention, staff in my office reached out to staff in the minister's office, and indeed we're able to work collaboratively to address some concerning situations on the ground. I can't go into specifics because they generally involve into specific individual situations in long-term care or other situations. So indeed, we do work collaboratively whenever it comes down to immediate concerns, the lives of Albertans. Absolutely, there is no partisanship involved whatsoever. In terms of friendliness, well, early on last year, I remember sitting during the first session, went over during committee of the whole. I sat down with Mr. Shandro. We had a good conversation. We talked about our mutual love of comic books. He made some recommendations. I made some. I'll be honest; those kinds of conversations don't tend to happen anymore, and it's challenging. I mean, when I see how toxic this government has been willing to be, when I've seen how far they've been willing to go, when they have been attacking individual doctors on social media, when they're targeting individual Albertans, when he actually went to yell at a doctor in his driveway, that for me crossed the line. And that makes it incredibly difficult for me personally to want to maintain that kind of a friendly relationship. I think there has to, if this government cannot have real and genuine respect for Albertans in the policies they put forward and understand the impact that they're having on them, I find it very difficult to maintain a friendly relation at that point.
Okay, so you've been described by Health Minister Shandro as conducting a political publicity stunt. Is this how what you do? That's a bit toxic, I think. It's not, an amiable comment to a colleague.
It's, my job is not to give the government an easy ride. My job, the official opposition, is to hold this government to account, and it's to listen to Albertans. And let's be clear, that's where I start. I don't sit down and go, what's the most political thing I can say today? What's to my advantage? I see what's happening and I reach out and I talk to doctors. I've talked to hundreds of doctors across this province, and the concerns that I have brought forward are precisely what I've heard from them. I talk to patients. I read the emails that are sent to me. I reach out to people and I find out more, and we find out what those concerns are and we bring them back. So I am not in this for my own agenda. I am in this to do the job that I was elected to do by the people of Alberta, to reflect their voice and their concerns and bring those forward. I'm going to do that to the best of my ability. with all of the tools and resources and through whatever means I have. And indeed, I've worked very hard in this role to not only, criticize government policy, but to bring more information to Alberta, whether that's through Facebook Lives, whether that's through my podcast, The Herd. I bring in actual experts. I bring in the frontline people themselves, let them share their experience, their stories, their knowledge. Indeed, I dare say we have worked to put out more actual information and context on many of these issues than the minister or this government themselves. So I consider it my job to listen to Albertans, to raise their voice, and to provide public education. And that's going to be done through the media. That's going to be done through social media. And I plan to keep doing it.
Awesome. I've got two comeback questions here, follow-up questions. So, okay, given all this talks, all this incredible relationship you guys have doing politics and the fierceness of the NDP right now, how is the NDP planning to make a comeback? And do you find with all the work you do you find that this UCP government actually listens to you? Do they try to take on board any of your wise policies? Do you see them doing that at all? So two questions there for you.
So let's start with the second question first. Does this government listen to us or take our recommendations? Largely, no. So we brought forward a number of amendments to Bill 30 to address very real concerns. Every single one of them was voted down. Indeed, what we saw was the government acted to limit debate. And we had many more amendments to go. They did not even give us the opportunity to bring them to the floor. Every time we oppose a bill, we bring forward substantive amendments and suggestions for how we think things could be changed and made better. 99.9% of the time, the government rejects them outright. Indeed, most recently, we had the issue of safe reopening of schools. I can't tell you how many parents, how many teachers, how many school principals, how many folks have reached out to us with very serious concerns. We proposed early on a 15-step reopening plan, a different way that the government could approach this. And they didn't have to take it verbatim. They didn't have to do everything exactly the way they said it. We said it, but there was many opportunities by which they could have done much better. And what we saw some very small movement from the government in taking on a few bits and pieces. But in general, they utterly rejected and turned it down. And now we already see, as cases are starting to spread in Alberta schools, and we're going to see what kind of impact that has. So unfortunately, I'm not sure that Alberta has ever had such a dismissive, toxic, condescending government in place towards its opposition, and indeed towards any Albertan that raises concerns with their policy and proposes alternatives. Now, in terms of how we intend to, continue to work as the Alberta NDP, well, we are doing what we have always done. We talk to people. We represent the real voices of everyday Albertans. And that has been my goal as Health Critic, is that I, through my office, and indeed Claire McDonald, who runs my office, has been an incredible help for me. And we respond to all of our emails. We reach out to people and talk to them by phone, by Zoom. We continue to reach out. I've toured the province to go and talk with doctors, nurses, other folks on the ground. And all of my colleagues are doing that too, in their communities, in their critic portfolios, all across Alberta. That is what we are going to do. We are going to continue to reach out to Albertans. We're going to continue to support them to raise their voice. And we're going to continue to empower them to raise their voice, to create change in their community, to make sure that they are able to one day have a government that truly reflects their values and what they want to see in their province.
I thank you. So we move on to Black Lives Matter. What does this movement mean to you?
Well, the strict Black Lives Matter movement, of course, came out of the multiple deaths of Black men at the hands of police in the United States. And ultimately, what this movement is about is recognizing the fact that for hundreds of years, the value of a Black life in America, and indeed in Canada and many other parts of the world, and recognizing this is equally true, and if not even more true, for Indigenous lives here in Canada. That those lives have been treated with less value. They have been treated as disposable. They have been treated as something to be used for the profit of others. The Black Lives Matter movement is about saying that can't stand anymore. We cannot accept that. We cannot continue to live that way. We must make change. So a lot of that has been focused, of course, on the criminal justice system. But I think the spirit of it carries through to many other areas, and really addressing the deeply rooted overt and systemic racism that is part of all of the systems that govern our society. So Black Lives Matter is about saying we cannot tolerate that anymore. We must make change.
I accept. But what does it mean to Mr. Shepherd on a Thursday afternoon?
What does it mean to me personally?
Yeah.
Well, it's something that has had a deep impact on me. I did not grow up with much of a sense of my Black identity. I did not grow up connected to a Black community. So it was really around 2012. I believe with the murder of Michael Brown in the United States, that I began to sort of follow these stories on social media, and I began to follow Black activists and advocates. I began to follow Black journalists and their reporting on the situation, and I began to really think about how different the experience and the lives of these individuals had been than mine. I grew up with incredible privilege here in the city of Edmonton, growing up in a white, my mom's white, growing up in the white evangelical community, growing up in a middle-class family, having learned at a very early age how to speak and present myself in a way that nobody found offensive. I had encountered very little overt discrimination and racism in my life. And through the Black Lives Matter movement, I began to learn how different that is for so many others. So when I was elected in 2015 and began to get invited to events with different Black community organizations, different Black communities, I began to see how much it meant to them to have someone that looked like them, who shared a heritage with them in a position of power. That led to me dedicating myself to really spending as much time as I could with those communities, with listening to them, with learning from them. It's been an incredible journey for myself in, rebuilding that connection with my own Black identity and learning. So Black Lives Matter to me is now, it's an opportunity for us to happen to see some real change, and we saw that in June with the movement being resparked by the murder of George Floyd. We saw all of a sudden a shift in a willingness to talk about this in the public sphere, for this to be part of our everyday mainstream discussion, and perhaps actually make some real and profound change. We're still working on that. But to me, Black Lives Matter is the driving force behind that. It is the spirit that I have to keep in mind, that I have to continue to listen to and educate myself on, to best use the platform that I have the privilege of holding as a Black man, to represent my community and to see these changes made.
Do you have any confidence in Minister of Justice Casey Madu being in charge of prisons, the judiciary system, as a Black man?
So certainly, it's a historic moment, and I congratulate Minister Madu on that appointment. He's the first Black Minister of Justice ever appointed in Canada. That is an incredibly significant milestone. I deeply appreciate what I've heard from the minister so far in terms of his commitment to address the issues of carding and street checks, and just that form of discrimination, which we know has occurred through policing in the province of Alberta. We saw clear statistics that were released on that a few years back by activists in the community. Indeed, that was Black Lives Matter Edmonton that brought that forward. So indeed, if the minister does in fact move forward with real and substantive change on that issue, he will have my full support. I will be very happy to stand behind him and to give him recognition for taking those steps. We will see what other steps the minister might choose to make. There's unfortunately some very toxic rhetoric, which is coming forward today around policing in the province of Alberta, at a time when our municipalities are working very closely with their police departments to listen to the community and to make positive changes, and to look at the distribution of dollars, which was something Minister Madu was very adamant about when he was in the role of municipal affairs, but now is suddenly starting to micromanage and trying to meddle with how our municipalities might choose to approach their policing budgets. So I find those sorts of steps concerning, and I don't think reflect what I am hearing from the Black community in terms of the kinds of changes they want to see. So I will continue to watch and monitor what Minister Madu chooses to do. And if he is making decisions and taking steps that truly benefit the Black community, he will have my support.
I'll say amen to that. We'll watch and we'll monitor it together. As a Black man in opposition, do you think more Black people should get involved? Do we need to see more Blackness in politics today, or not?
Absolutely. Absolutely. That has been one of my goals from the time I was elected, from the time that I first had the opportunity to start connecting with the Black community in Edmonton. One of my goals has always been to work with community groups, not just to win their support for my purposes. My goal has been to empower them to address the goals that they want, to achieve, to pursue the policies they want, to achieve the things they want to achieve, and indeed to make more room. And part of the challenge is, of course, if we want more Black people involved in the political realm and moving into positions of power, they need to have opportunities to learn. They need to learn about the systems that are involved and how to operate in them. They need to build networks. They need to build connections and relationships. They need to develop leadership experience and have the opportunity. And those are all things that have been more challenging for people from the Black community. And let's be clear, particularly for Black women to have access to. They face twice as many barriers, than their counterparts in the Caucasian or other communities. So that has been part of my work as well, trying to see how we can sort of lift up and support people. That's work I've done on a party side. That's work I do as an MLA. And absolutely, my goal is in 2023 to see far more Black Albertans having the opportunity to run for office. Indeed, that's what I'm hoping to see next year in our municipal elections. And I look forward to having the opportunity to support candidates for that role as well. Because frankly, one of the biggest challenges we have is representation. We need more people at the table who understand the experience of living Black in Alberta, who understand the issues and the challenges, who understand their communities, who can bring that voice to the table. And I will do everything I can to make room for that.
Do you see Black people as being more empowered in Alberta today or less empowered?
That's a fair question. I mean, I guess it depends what you're comparing it to. So certainly we are better now than in the early 1900s, when the exodusters first began to come here from the southern U.S. We are further ahead than we were in the 1960s, when the federal government finally lifted its restrictions on Black immigration. And my father came to Canada in 67. And I've had the opportunity to talk with folks about their experiences. I've had a chance for a lot of education about Black history in Alberta, the people that have fought against discrimination and fought for greater rights and freedom. So indeed, we are further ahead now than we were then. But that does not mean that the work is done. There is still a lot to do. We still know that Black, Indigenous, people of color in the province of Alberta still are underrepresented in positions of power, whether that's in the corporate sphere, whether that's in the political sphere, whether that's in community. We know that they generally earn less dollars. We know that they generally have less opportunity, less networks, less connections. Now, I am seeing in the wake, again, of Black Lives Matter, a lot of great work to address that. Folks like Startup Edmonton, doing a Black entrepreneur mentorship program. I see organizations all over the place working now to increase representation and to get more Black voices to the table. So I think we are continuing to make progress, but it's something that we cannot sleep on. It's something that we cannot pause on. And we cannot say that a few cosmetic changes in policy are going to be the end of the game. This is the beginning of the conversation. We've still got a lot of work to do.
Right. I'm just curious as to your thoughts with the deployment of the school resource officer program. Is that something you're pleased with or not? Do you feel finally the Edmonton Public School Board is listening to what people are saying?
So, as I said, one of the most important things for me as an elected official is listening to the people I represent and bringing forward their voice, and helping them to amplify what it is that they want said at the table and what they want to see. In this case, I heard very clearly from the community that the school resource officer program was a problem for Black, Indigenous, and students of color. That for those students, it made them feel less safe in their school, in their space, and was an impediment to their ability to learn and to thrive. I really appreciate that the EPSB listened to the voices of community, that they worked with them and take the step, and that they have taken a clear step to address that issue in removing SRO officers from the school environment. So I look forward to sort of seeing what next steps might take as they work with the Edmonton Police Service to determine in what other ways the school board and them might interact. And chiefly, the most important thing for me is that I will continue to listen to the community to hear how they feel about the next steps going forward. But certainly I applaud the EPSB for this step and listening to the community.
What are your goals for the rest of your time as Health Critic?
That's a big question. My job as the critic for health, and particularly as a member of the Alberta NDP caucus, is to protect the integrity of our public healthcare system in Alberta. That's a legacy. Medicare is an NDP legacy. Our man Tommy Douglas, one of the most famous and popular Canadians, that is something that is deeply important to Albertans. And indeed, the delivery of healthcare services in the province of Alberta is something that needs reform. I won't deny that. There's a lot of work to do. But my goal in my time as a healthcare critic is to ensure that Albertans know clearly what this government is choosing to do, that they understand what the potential impacts are, that their voices are heard at the table. And I want to educate Albertans about that system, to get them engaged and invested, to be able to protect the system that is so important to them. So I'm going to continue to hold this government to account. I will continue to raise my voice and the voice of our healthcare providers, patients, everybody that interacts with that system, to ensure we have a strong, publicly delivered, publicly funded healthcare system in the province of Alberta.
Do you get time to read at all? If you do, what are you reading now?
Absolutely. You know, I do occasionally. I just had some vacation time at the end of August. It was a long time coming. It was a great time. I spent some time in the Kootenays, did a bit of hiking, and I did do some reading. So was just doing some very light reading, a book called Nosferatu by Joe Hill, Stephen King's son. So yeah, a little bit of sort of horror fantasy novel. It was just a bit of escapism, but I enjoyed it very much.
You know what? Horror fancy just kind of sounds like you. I'm not like too disappointed. It kind of fits with the profile of Mr. Shepherd. I know. I want to say thank you for your time today. I know you're excessively busy, but you've taken time out, and we've taken enough of your time, and we thank you so much for coming on the Yeg Show to share your thoughts about Bill 30 and Black Lives Matter.
My pleasure. Thanks for having me, T. I look forward to joining you again in the future.
Yes, sir. Thank you. Enjoy the rest of your afternoon.
You too.